And into Friday. Tessa?
Thanks, Tom. Well, it's been 30 years since the Orphan Drug Act was approved, paving the way for drug companies to develop treatments for rare diseases. In fact, sales of orphan drugs have surged nearly 26% between 2001 and 2010, and that's faster than the growth of traditional drugs for more common diseases. And as we hear in this report, that progress is helping people with an extremely rare condition.
A rare disease is defined as any condition affecting fewer than 200,000 Americans. They're more common than you may think.
There are actually about 7,000 of those diseases recognized in the U.S., affecting almost 30 million Americans. So everyone knows somebody with a rare disease. Some of them are diseases like cystic fibrosis that most people have heard of, but there are many like short bowel syndrome that probably most of your viewers have not heard of.
Short bowel syndrome affects about 10 to 15,000 Americans. It results from the loss of a large amount of small intestine. That leaves patients with too little bowel to absorb fluid and nutrients that they need to survive. Doctors work with these patients to try and maximize the effectiveness of their remaining bowel using medication and dietary changes. But for a large number of patients, it's still not enough.
Many of these patients require intravenous nutrition called TPN. This is a specialized form of intravenous fluids that they infuse on a nightly basis over about a 10 to 12 hour period. More recently, the FDA approved a drug called Gattex, which actually enhances the absorption of the bowel and has potential to get patients off of TPN.
The National Organization for Rare Disorders, or NORD, is a great resource for patients with short bowel syndrome, as well as any of the other 7,000 rare diseases. Visit rarediseases.org to get the facts.
The content of this segment was provided by NPS Pharmaceuticals.